Would you like to expand on a little bit of that as that relates to your approach, some of those things that you use around body language and tonation, perhaps as it relates to some of the tips that you share when you're doing your workshops or when you're speaking that just help to give people a bit more clarity?
What I do is really what I do workshops when I do workshops with health professionals. The first stage is that we do different exercises where we discover certain things. I would say weaknesses in brackets, certain things that we have in ourselves. We know they're there, but we never really understand how they are related to our work. I may be very sensitive. I may be heartbroken. I may be stingy with money. I may be, but how does this relate with my sessions with my patients? Because remember, I always tell this to participants, the patient x-rays us. They walk into our office, they do an x-ray. You're talking, but they are observing everything about you. Just like you're building a house and you have your meeting with an architect or an interior designer. You don't only listen to what they have to say professionally, you also check them out as people.
Scrutinize.
This is what patients do with us. So don't even think for a minute that they don't see our weaknesses. So, and not only that they see them, but they interpret them. They make stories about them. So it's to our benefit to know how these characteristics that we have relate to our sessions, because, for example, one characteristic that I have is that I laugh a lot. And sometimes, people, we start a session and I laugh, and some people interpret this that I'm not very serious. So knowing that about myself, I make a comment, sorry that I laugh, this is my nature, but, I fully understand what you're telling me. And then when I show them that I'm very serious about what they're telling me, this sort of explains itself.
So helps you frame, doesn't it?
Right. So first we discover a few things about ourselves. Then the second stage, we know how to relate these things to our patients and to our sessions. And then the third stage, I teach them different communication techniques, like body language. I use all kinds of methodologies to make up the WWYP approach and NLP and anything that would work. And then they understand how they can use this to communicate better with their patients. And then they understand how they come and reach the unique diagnosis of their patient. So it's like a 4-stage thing that we go through in the workshops, and and people who participate, they love it. They understand how necessary it is.
Yes, but you don't know what you don't know until someone shares the knowing with you. I was reading some of the reviews and some of the comments on your website about the way in which that your approach is very simple. It obviously helps them understand it very simple, and they've lots of people have used the word pioneering. But which is awesome, and I can certainly see that with the way the conversation, and it's what I've just found funny about my own perceptions prior to coming on and having the interview with us. You on your website or in my notes, I had written, it was written down, work with yourself, work with your patient approach, and I've gone, no, that's around the wrong way. So I had actually edited it and sort of gone, well, surely it's that. So that was actually interesting that I'd had a perception around that. Now, having had the conversation, I now know why that was
Yeah.
positioned first on your website versus second on your website. But I did copy and paste it and sort of went, that's a bit interesting. I'm not quite sure I understand that. And then I changed it. So that to me, and that conversation we've had around as to what we bring to face our clients has just made me chuckle, because I've just done that myself. Which then reminded me when you were talking about how those little things in our room and how our patients or clients will, and I use the word scrutinize. I was at an event, at an house opening on the weekend, and it was the builder and the architect showcasing their place. And I'm a bit of a neat freak, and I love a good showcase, but I expect the sinks to be cleaned out. I didn't expect to have builder's dust still on the sink. So of course I wanted to get my cloth, because to me that should have been cleaned and all those sorts of things. It was a pre-launch before the real launch, so I get why it was there. But it's those sorts of things. I was scrutinizing the space because it wasn't where I expected it to be. So it just shows how we do this and we don't realize how we do this every day in every single moment.
Definitely.